What to expect at your doctor's appointment. Arriving at the doctor's office. Upon arrival at the office, the front desk staff will ask for your identification and insurance information. At this time, you should communicate that you will need an interpreter to assist you during your visit. You have the right to an interpreter if requested, and the clinic must provide one. Sometimes it's an in-person interpreter, but most of the time it will be an interpreter via the phone. After returning your identification and insurance information, the receptionist will give you paperwork to fill out. If you do not read or write English, you should ask the receptionist for assistance or wait until an interpreter can assist you. This information generally contains information about your medical history as well as other relevant information about your family, occupation, and education. It is important to provide accurate information on this form so that the medical professionals can get a good understanding of your situation. This information will guide them for the rest of your visit. Know that this information remains private. Doctors are not allowed to share this information with anyone who is not treating you. It is better to use an interpreter than a family member, even if that family member is proficient in English as well. There may be medical terminology during the visit that an interpreter will be more equipped to communicate. Once you have filled out the intake form with your interpreter, the form will be returned to the receptionist. Now that you are checked in and ready to see the doctor, you can take a seat in the waiting room. Your wait may be long or short depending on how busy the office is on that particular day. Seeing the doctor. Upon entering the exam room, the nurses or medical assistants will normally check your temperature, blood pressure, and sometimes your weight and height. Once that is complete, please sit patiently in the room until the doctor comes in. When the doctor comes in, he or she will ask you personal questions regarding your medical history, family history, travel history, and medications. They may also ask you questions about your sexual history, as well as alcohol and drug use. Please do not feel uncomfortable if the doctor asks you very detailed or very personal questions about your life. You can trust the doctor. They are only asking these questions to obtain more information about your health so that they can better treat you. Remember, you have the right to an interpreter, so don't be afraid to ask if you haven't already received one. Please do not have side conversations with your interpreter. Your interpreter is there only to translate conversations between you and the doctor. The doctor will finally ask you to describe how you are feeling and any concerns that you may have. Please be honest with your doctor. Know that everything will be kept confidential. If you have any questions or if you're confused, please tell the doctor. The doctor is there to help you. Maintaining your dignity and respect is as important to doctors as is treating you. The doctor will also perform a physical exam, which includes touching areas of your body. For example, the doctor may ask you to move your arms and legs around. The doctor may ask you to undress and change into a gown in order to perform the physical examination. If you don't feel comfortable with this, or if you have any questions, please express your concerns to the doctor. While examining you, the doctor may ask you questions. Answer their questions honestly and follow the directions carefully. Do not be afraid to ask questions yourself or say something if you are concerned or confused. They want you to understand and are happy to answer your questions. Note that during the visit, a doctor may leave and a different doctor or nurse may enter. You should remain in the room until you are told that the exam is over. Remember, the doctor and healthcare team are there to help you get better. You can trust your doctor and the healthcare team. Please do not feel shy or uncomfortable sharing detailed information with your doctor. The more information you share about your sickness, the more the doctor can help you. Everything you tell the doctor will be confidential and will not be shared with anyone else. During the visit, the healthcare professional may perform small procedures. These procedures can help the doctor understand your diagnosis or provide you treatment. These procedures may vary from checking your urine, to checking your blood sugar, to giving you a vaccine. If you do not understand what the doctor is asking you, or if you do not understand the treatment, please ask questions. It is very important that you ask questions if you are ever confused. While you may be afraid or intimidated by the doctor, it is important that the conversation about your health is a two-way conversation. By asking questions, you can learn what tests you will need, what your diagnosis means, and what the next steps are after you leave the doctor's office. Check out. When you leave the exam room, you must go back to the reception desk to check out. This is very important. At checkout, the receptionist will help you with the plan you discussed with your doctor. Since most medical offices do not take walk-ins, you may need to schedule another appointment at the same office or another doctor's office. The receptionist will ask for your input on a specific day and time to visit the office again. Additionally, the doctor may want to send you for further testing or to a specialist. You'll need to call this office and set up a separate appointment. These tests may include getting radiology scans, getting a skin lesion removed, or getting your blood drawn. When you call that office, please have your insurance information available. The receptionist will give you the contact information of these places. You can also ask the receptionist for referrals to a specialist and where the nearest testing centers are located. The treatment plan that you agreed on with your doctor may also include getting medication. If this is the case, your doctor will electronically prescribe the medication to the pharmacy of your choice. It is important that you ensure that you know the phone number, address, and location of the pharmacy you will pick up your medication from. Do not leave the office until you understand exactly what you need to do before your next visit. Once you understand the plan and have all the necessary information, feel free to leave the office. If you lose information or forget what to do before your next appointment, feel free to call the office to clarify any information. Your doctor and the staff are there to help you.